Each week, I hold 1 or 2 forums in the district on topics vital to your life. Here's another show that we taped.
Thank you so much, and I appreciate all of you coming out today to hear about this very important topic about diabetes prevention and diabetes management. There is a handout packet for each of you. It's several pages of information, so those of you who may have come in later, make sure you have a packet. And I have additional packets down here for people that come in later. Okay, so I'm a registered dietitian and a certified diabetes educator. I'm the director of the Diabetes Education Center at Winthrop. Our education center has been in existence for over 37 years. We were the first in New York State and one of the first centers in the nation to provide an area where people with diabetes could come to learn about how to self-manage their diabetes. We work in conjunction with an individual's physician, and we're a staff of nurses and dietitians, and we really help people figure out, the steps that they need to take to help manage their own personal diabetes. So our approach is personalized, and we have individual consultations as well as group consultations. The focus of our program today, since probably not everyone in the room has diabetes, is really to make people aware of what are the risk factors for diabetes, because it's a very prevalent condition in our country at this time, and what are some of the things that if you are at risk you can do to prevent getting diabetes. And then if you have diabetes, we will talk a little bit about positive steps that you can take to manage your condition. So probably everybody in the room knows someone that has diabetes, whether it be a family member, a friend, a neighbor, or perhaps you may have diabetes yourself. So it's, like we said, a very, very common condition. In your packet, there's a risk test. It's the first yellow sheet that you see there. And if you don't have diabetes, it's a test that you can take to quickly assess whether or not you are at risk for the condition. I encourage you to take the test if you don't have diabetes and to share it with other family members. And we'll be taking a look at that test in just a minute. And if you've been to Mineola, perhaps you've noticed the new research building. Have you seen it? Yeah, it's a state-of-the-art building, and here we house all of the adult and endocrine diabetes practices. We also have, the 4th floor is dedicated to research. There's a lot of research going on there about how to take care of diabetes and obesity, and I believe they're doing some cardiovascular research there as well. Winthrop's administration has made a very strong commitment to helping people with diabetes and obesity. And they've committed the resources, as you can see here, to help individuals in the day-to-day management, but also to research and look forward to the future. So what are some of the facts about diabetes in our country? Currently, 1 out of 11 people in the US has diabetes. What's most shocking about that is 1 out of 4 people have diabetes and don't even realize that they have it. Some of the common symptoms, increased thirst, increased urination, maybe feeling tired, are sometimes things that we ignore. We say, oh, it's too hot, or I'm on a diuretic, I'm drinking a lot more, I'm tired just because I'm working so much, or I'm stressed out about something. So often the symptoms go unrecognized, and then the person ends up at their doctor for perhaps even another reason, and that's when the diabetes is diagnosed. When it comes to prediabetes, so this is in the years leading up to the diagnosis of actual diabetes, 1 out of 3 people in our country have prediabetes. So this is really where we want to attack. We want to move in when people are in the prediabetes condition and take positive lifestyle steps, because we know from very large-scale research that intervention in prediabetes period will prevent diabetes. So the scary thing is that 1 out of 3 people have prediabetes, but look at this statistic. 9 out of 10 people with prediabetes don't even know it. So this is when the numbers for blood sugar are just starting to creep up. So imagine, easy, just not even to know. When you go back to what we talked about before, The people with diabetes with even higher numbers sometimes aren't aware of the symptoms. So the Association of Clinical Endocrinologists has made this statement that diabetes is one of the most significant and challenging public health issues of our time. So you will see many physician groups, diabetes-related groups, taking very, very strong steps to try to educate people, to try to help intervene, to manage diabetes, and to prevent a progression to diabetes, because there's a huge economic burden on our society for managing people with diabetes, and not to speak of the personal burden and the burden on the family. So many of you perhaps could relate to this statistic. In the population of individuals 65 and older, 50% of people have prediabetes. This is staggering. So I highly encourage you that if you're in this age group and you do not have diabetes, please go to your physician, have a regular checkup, and in the course of a regular routine lab work, the doctor will run a fasting blood glucose level. And that can be the first indicator as to whether or not something's starting to happen with your blood sugar readings. So, we want to take these positive steps. You want to go to your physician. You want to be proactive. You are the educated consumer. Go to the physician, say, hey, I heard this statistic that, 50% of people over 65, might have prediabetes. Am I at risk for that? Am I a candidate? Can you check my sugar? Okay, and that's when your doctor steps back and he looks at your whole medical history, and he may order just a glucose. He may order even a more sophisticated test called an A1C that we'll talk about in a minute. We're fortunate in the New York area to have very educated physicians. They're very aware of this condition, and they're intervening nicely. What we want to really focus on is that if you're diagnosed with prediabetes and you do nothing, we know that within 5 to 10 years that will turn into what we call type 2 diabetes. It's even closer to the 5-year mark when that can turn into type 2 diabetes. So what can one do when the numbers are starting to creep up? It's about taking some lifestyle changes. And the changes are centered on being more physically active, and also, if you have a few extra pounds, losing that weight. And we're going to take a look at a large-scale research study that was done in this country and replicated abroad that spelled out exactly what people in the prediabetes condition have to accomplish in order to prevent progression to diabetes. So how do you know if you're at risk? Well, you could take that risk test that I gave you, but these are some common things that put people at risk for diabetes. Some of these we can't do anything about. Our age, our age is our age. Okay, so unfortunately, as we get older, it gets a little bit more difficult to control blood sugar. And the most important thing, family history of diabetes, is certainly something we can't change. They say that we could choose our friends, but we can't choose our family. So we get the genes that we get. And when it comes to type 2 diabetes, this condition is very strongly genetically driven. So if you have someone in your family who has prediabetes, type 2 diabetes, you want to pay attention. You want to make sure that you're getting screened in order to see where you fit into that picture. Some of the other risk factors here, like being overweight, being less physically active, they are things that we can make changes in that will significantly help the progression. So when it comes to different populations, some ethnic groups are more at risk than other groups. And we could see here that our Native American Indians have the highest risk of diabetes, and followed by non-Hispanic Blacks, Hispanics, and Asian Americans. So you want to pay attention to your ethnic background. Does that put you at risk for diabetes? So let's talk numbers. So how do you know, based on laboratory values, whether you fall into the prediabetes or the diabetes range? So when you go for a routine lab work, the physician will do what they call a fasting glucose. That's a glucose level. So obviously you should go in fasting. That's after an 8 to 10 hour overnight fast, preferably. And if you have a reading between 100 and 125, that's prediabetes. And once we tip over that, 126 or above, we call that diabetes. Now, we never diagnose diabetes on the basis of one number. So if, say, you get a 126 or higher, the physician is going to rerun that lab test because we could have a lab error. But let's just say, if you are having a fasting glucose level and the number has tipped over 100, red flags should be going up. Okay, we want to pay attention. Now, the fasting blood glucose test at the lab is that one moment in time. I call it a snapshot. It just tells us on that day, at that time, that's what your blood sugar was. We have a more sophisticated test called the A1C. You may have heard it referred to as the hemoglobin A1C or the glycosylated A1C. And sometimes if on a routine screening, a doctor's not going to run an A1C. It's a more expensive test. But if you have family history, other medical conditions that might make the doctor suspicious, they may add this test in. So prediabetes A1C levels are 5.7 to 6.4. And when we get to 6.5 or higher, we call that diabetes. Why is this test give us a little bit more information? Well, I call this the video camera of diabetes, a glucose control. It gives us a look back over the previous 2.5 to 3 months at pretty much every minute of the day how things are going with your blood sugar, and it averages all the numbers together. So it gives us a more information than that fasting glucose, which is the one moment in time. So these are some numbers that can be used for screening and diagnosis. If you have diabetes, you should be seeing your physician regularly and you should be having your A1C checked. So just to take a step back, some of you may not really be so familiar with what diabetes is. Physiologically, diabetes is when the body either doesn't have enough insulin or the insulin that's being produced is not working so efficiently. So we have two types of diabetes. The pancreas is the organ in our body that produces insulin. It sits over there behind the stomach. In type 1 diabetes, true type 1 diabetes, the person produces little to no insulin. So they must depend on insulin injections for their very life, okay? So we commonly think of this as young children who get diabetes. They have to take insulin by injection, perhaps they wear an insulin pump, that type of thing. But we have many adults who have type 1 diabetes as well. Type 2 diabetes, on the other hand, is when the body's not so efficiently using the insulin that's being made. So in type 2, that's the type that most people have. Almost 90% of people with diabetes have type 2. The body's making the insulin, but it's just not working so efficiently. So that's where the lifestyle modifications centered on physical activity and eating more healthfully, especially to lose weight if that's indicated, can help to improve the blood glucose numbers. There's a misunderstanding that if someone is on insulin, it means an adult is on insulin, that it means that they have type 1. You can have type 2 diabetes and be on insulin. Okay, so that's a common misunderstanding that people have. Luckily today, in the management of type 2 diabetes, we have many medications. When I started as a diabetes educator over 30 years ago, we literally had 5 pills. You could count them on one hand to give to people who had type 2 diabetes. Now at our Diabetes Education Center, when we teach the class, our nurse gives a 2-page list of medications. So we learned quite a bit over the past few years, and we have developed different medications that target different organs of the body to help achieve the control that people need. So we want to be positive. I'm here to tell you that diabetes is a condition that can be managed. Many people are fearful when they hear the word diabetes, whether it be prediabetes or type 2 diabetes or type 1, but it's definitely, we have many more tools available to us to help people manage. So let's go back and take a look at what's happening if you're diagnosed with prediabetes. So you go to the doctor, maybe you have that routine lab work. you're feeling fine, everything's going okay. And he says, you know, you have a fasting blood sugar of 102. This is prediabetes. We need to pay attention. And you're shocked. Happens all the time. Well, what happens is in the years before type 2 diabetes develops, like we said, 5 to 10 years before it develops, something's starting to happen with the blood sugar. The glucose level is slowly creeping up. So in those early years, the pancreas, that organ that makes insulin, is working harder and harder, putting out more and more insulin to keep the blood glucose levels in range. As time goes on, if nothing's done to help kind of maybe reduce the burden on the pancreas, that pancreas will get tired and it will start to put out less insulin. And that's when we see the glucose levels start to rise at fasting and after meals. And that's when we have the diagnosis of diabetes. So that's when you are going to the doctor at that point in time and the doctor's saying, oh, your fasting glucose is over 126 now. So what we know about diabetes, and here we're referring to prediabetes and type 2 diabetes, it's very strongly genetically driven. So once again, if you have someone in your family who has a history of diabetes, you want to make sure that you're talking to your physician about that, letting the physician know. This genetic setup can start to have somebody develop issues with their fasting blood sugar level in the morning. And if we don't intervene with weight reduction, if that's indicated, or being more physically active, that impaired fasting glucose can turn into diabetes. So at Winthrop, we are proud to say that we had, once again, one of the first diabetes prevention programs in the whole entire state and country. We started that many years ago with a grant from the Mineola Lions Club. And we started a 2-session program. And what's happened about 2 years ago, we decided to move to the CDC, Center for Disease Control curriculum, where the intervention is a 1-year intervention. And using our grant funds and the support of Winthrop Hospital administration, we now offer the prediabetes program, 1-year program, for free. And the program is centered on helping people to make the lifestyle changes for weight loss and increasing physical activity needed to reduce the risk of developing diabetes. So what happened was your tax dollars hard at work. Many years ago, there was a large-scale intervention done in this country where they took individuals with prediabetes and they put them into a study. And there were 3 arms to the study. And in one arm, they said to them, you have prediabetes, you need to lose weight, and you need to do 150 minutes of physical activity a week. The second arm, they said the same thing, but they gave them the drug metformin, which is the first-line defense medication used in diabetes management. And then the third arm, they didn't give them medicine. They said you have prediabetes, you need to lose weight, and you need to do 150 minutes of physical activity a week, and we're going to help you with a lifestyle coach. And you're going to come to classes over a year, and we're going to give you all the tools and help you develop all the skills and knowledge that you need to manage this condition. Which group do you think did the best? The third group. The group that had the help over 1 year of intervention with the lifestyle coaches to help them to lose weight and be more physically active, 60% of those individuals prevented progression to full-blown type 2 diabetes. The group with the medicine did well, but the statistics were not as high as 60%. So the CDC said, this is a wonderful result. They stopped the study a year early, and they said, let's get the message out to people. So they wrote a curriculum, and they encouraged many different organizations to adopt this program. So the YMCAs have launched the program, but at Winthrop we also have launched the program as well. And like I said, we're happy to say that we're able to offer the program for free. And the way that it works is the individual who qualifies for the program comes weekly during the first 6 months, and then in the last 6 months they come monthly. And again, they work with the lifestyle coaches to help lose the weight and to be more physically active. So you actually have a brochure in the packet. It's called the Diabetes Prevention Brochure, the Diabetes Prevention Program brochure. That's your first packet. So that explains who would be eligible for the program. So if you have prediabetes or type 2 diabetes, physiologically what's going on is there's this condition called insulin resistance. The body's making that insulin, but it's not working so efficiently. So what are some steps that you can take to help treat the condition? Well, the single most important thing that you could do is to stop smoking. Smoking, I'm sure you've heard it over and over again, it affects the vascular system of our body. So in terms of insulin resistance, it has a huge impact, negative impact, so that would be the first step. Lose 7% of your body weight. And where does the 7% come from? Who determined that? Well, that was that large-scale study that I mentioned to you. The individuals in the prediabetes group who reduced their progression to diabetes by 60% lost 7% of their body weight. So 7% is like a weird number. If you think about it, for a 200-pound person, that's around 14 or 15 pounds. And if you ask most 200-pound people, have you ever lost, 10 or 15 pounds? And they would tell you yes. The difference here is we want to get that weight off and we want to keep that weight off. And that's what the 1-year prevention program helps to do. Because we recognize it's easy to lose weight, but it's hard to keep it off. Would you agree? Yeah. Also, what you want to do to help you move towards a healthier diet is to move towards a healthier diet with a focus on reducing the fat intake, increasing fiber, and for sure eliminating any kind of sugared beverages. So regular sodas, sweet beverages, sweet teas. This is a popular time of the year for all these frozen fruit drinks and things like that. Anything that has a lot of sugar doesn't belong in anyone's meal plan. And then the 150 minutes of brisk physical activity a week. So those are the steps, if you're not interested in attending a class or whatever, these are things that you could do on your own. And whether you're at risk for diabetes or not, if you're overweight or you smoke and you want to eat more healthily, these are the most positive things that you could do. So if you smoke, we have a Smokers Quit line. I encourage you to make a call. They have coaches there who will talk to you over the phone. And the program varies from time to time. Sometimes they have nicotine patches available. They'll give a 2-week trial of those to the individual. But it helps to get you started. We also have a smoking cessation program at Winthrop that you could take advantage of as well. So here's the 7% weight loss. So like I said, we could do the calculations for each individual, but it's about 15 pounds for a 200-pound person. And the general rule of thumb is to try to identify a way that to help you lose weight, you could cut 500 calories a day. And the most efficient thing is to try to, I feel, reduce maybe your caloric intake by 250, 300 calories, and increase your physical activity by 250, 300 calories, and then you don't have to cut your food as much. And then you're getting the benefits of both. So there are 2 kinds of body fat, and it's the visceral fat. This is the kind of fat that accumulates around our organs. It's the dangerous type of fat. It's associated with heart disease. It's a promoter of this insulin resistance. So as we lose the body weight, we're trying to lose this visceral fat. So like we said, there's no room in anyone's dietary plan for very highly sweetened beverages. We're doing better in reducing our sugar intake in the United States, but you could see we have had a significant increase over the past 20 years in our sugar intake. I think we just tipped the scale in the last couple of years with some of the massive public health education campaigns to decrease this sugar intake a little bit, but we have a long way to go, especially in our youth. There's a lot of sedentary behavior, and they're the big gulps from the 7-Eleven. This is another significant problem we have in our country. This is my friend, I nicknamed him Portion Pete. And he comes to me with all my programs, because if you could see that large hamburger, he very aptly depicts the problem that we have in our restaurants. We're fortunate in this Long Island area to have so many beautiful places to eat. You drive down the street, and in any given block or strip of Jericho Turnpike, Old Country Road, you could probably have 5 to 10 establishments to eat. And all of them have portions that are double to triple the amount that we actually need. So at Winthrop, we have a Dining Out with Diabetes series for individuals who have diabetes. And what we do in that program is we actually go into a restaurant, and we pick different ethnic restaurants, and we help individuals with diabetes to understand, what's in the food that they eat. People with diabetes particularly have to pay attention to carbohydrate. So we're helping those individuals to know the carbohydrate and contents of their food. But more importantly, we're really helping people to pay attention to the portions. So what makes up a healthy meal plan? It's really about having a balance of foods from all of the different food groups, using leaner proteins, so emphasizing trying to have fish maybe twice a week at least, using leaner cuts of meat, emphasizing more chicken and poultry, and it's really pushing the plant-based aspect of the diet. So you want to have about half of your plate coming from fruits and vegetables. If you have diabetes, you may have to rein in the portion of the fruit because of the carbohydrate content, but you really want half of your plate for sure to be vegetables. Adopting that one step helps you to decrease your intake of the other, too much other starch, too much other protein. And if you think about it, when you go to the restaurant, the whole plate is completely reversed. Would you agree? You get half a plate of pasta or rice, you get this huge portion of protein, 6 to 9 ounces, and you get a sprig of broccoli. So that's what our mission is to try to reverse the plate. And I would encourage you, if you eat out a lot and you're trying to lose weight, re-examine how frequently you're eating out. And try to eat a little bit more at home. Maybe with the summer being here now, we have all these terrific farmers markets here on Long Island. I encourage you to visit your local farmers market, buy the produce there. Try to be creative with your meal planning and emphasize half of your plate coming from the vegetables. The vegetables naturally are very low in calories. They have no fat unless we douse them with garlic and oil or hollandaise sauce or cheese sauce. But they come with a wide variety of vitamins and minerals and antioxidants. And in any type of chronic disease state, a more plant-based diet has been found to be very helpful. If you're interested in learning more about how many servings you personally should have from each different food group, you could go to myplate.gov. This is, again, our tax dollars hard at work. But this is a wonderful website. You can put in there your height, your weight, and whether or not you're interested in losing weight. The computer will generate an idea of about how many calories you should have, and it will tell you how many servings from each different food group that you can have. If you have diabetes or pre-diabetes, we have dietitians at Winthrop who can meet one-on-one with you for that. In diabetes, nutrition consultation, medical nutrition therapy is a covered benefit. Especially if you have Medicare, it's covered with no copay. So I would encourage you, if you have diabetes, to take advantage of that benefit. So here's the plate method, emphasizing half a plate of the vegetables, okay? Trying to keep a protein portion down. In a restaurant, you're going to get 6 to 9 ounces of protein. The average person really should be in the 3 to 6 ounce range, okay? But, look at what you're doing and try to make changes, maybe to cut by a third if you can. You look at your portions and take it from there. With the physical activity, like we said, what's recommended is 150 minutes of brisk physical activity a week. And that's, again, coming from that large research study that was done by the government. And remember, those individuals had prediabetes. 60% of them did not develop type 2 diabetes as a result of losing weight and being more active. So here they did brisk physical activity, and we'll talk about what brisk activity is. But the bottom line is, wherever you're at in terms of your physical activity spectrum, just move. Keep moving. It's important. Try to incorporate more activity into your daily routine. It might be that you're going to park your car a little bit further away from the store so that you take some more steps. Maybe if you can't really exercise too much, you might find a way to go to a mall or to go to, a lot of people go to Costco or Target and they get the shopping carts and they make their way around with the assistance of the shopping cart at their own pace in the stores. So the bottom line is to keep moving, and I'm sure that you've heard that the Surgeon General has said no one should sit for longer than 90 minutes at a time. Are you aware of that? And it's very important to constantly get up for your circulation. So like we said, you see the lady climbing the stairs here. Fit exercise in, physical activity in any way, shape, or form. If you could take stairs instead of an elevator, that's great. I always say get a dog, or if you have a dog, start walking the dog, and the dogs don't know what happened to them. But having a companion like that can be very motivating. You might not go out and walk yourself, but you probably would walk your favorite friend to give them some exercise. The ladies at the bottom, find a buddy, find a companion, friend to exercise with. It's very, very motivating. And earlier I was walking around the library and I heard some people in the basement exercising. So I believe that there's some nice programs going on here at the library too that they offer. So I encourage you to look for programs at your libraries, look for programs at your local high school. The community college, Nassau Community, has wonderful programs that are going on. We have wonderful park system here. So there's a lot of opportunities in our area for low-cost ways to incorporate physical activity. And I would encourage you just to try different things. Maybe try Tai Chi once. See if it's for you. You may or may not like it. Yoga, same thing. Try it. It's helpful, and you might meet a new friend too. So this is what I was saying. We should take a break from sitting, according to the Surgeon General. And these are some simple strategies that you can use to help you incorporate more activity in your daily routine. And in your handout packet, towards the back, on the green sheet, I've given you a handout from America on the Move, 100 ways to add 2,000 steps to your daily routine. So it's recommended that we walk 10,000 steps a day. Does anybody know how many miles that is? Yeah, it's almost 5 miles a day. That's a lot of walking. So what I encourage you to do is to get a pedometer, and there's some inexpensive pedometers. Put that on and see how many steps you take in a normal day. And then challenge yourself. If you're at like 2,000 steps in a typical day, challenge yourself. Try to do 200 more, 500 more. Make it a game and slowly work yourself up. Many of us have Fitbits now. Those are very motivational for counting the steps. If you have a smartphone, if you have some apps for your phone, you can also easily track your steps. So I would encourage you to get some tool to help you keep track. Now, if you have diabetes, just say also one other thing. In terms of the handouts, there's another handout in there, the yellow one. It's 100 ways to cut 100 calories. So if you can pick one or two of these things on this list and cut 200 calories a day and do some physical activity to increase your energy expenditure by a couple of 100 calories a day, you will work towards weight loss. And then finally in your handout packet from the Academy of Nutrition and Dietetics, there are 16 health tips for 2016, strategies to help you develop a more healthful way of eating. But I would also encourage you to use the myplate.gov website. Now, if you have diabetes, I'm here to tell you that, all the horror stories that you may have heard about diabetes, and everybody knows one, those can be prevented. Diabetes is a very highly manageable condition. It takes effort on your part to do all the things you need to do day to day. And it also takes working with your physician and the other team of professionals who can help you. But if you have diabetes, the key to control is what we call the ABCs. You want to manage your A1C for it to be less than 7%, control your blood pressure, and evaluate what's going on with the different types of fats in your blood. We have, as I said before, many new diabetes medications to help get people to goal. If people are on insulin, it's not the fearful medication of the past. We have insulin pens. We don't even do syringes and bottles anymore. If you have a grandmother who was on insulin, maybe you remember her boiling her equipment, boiling her syringes. None of that anymore. And we also have insulin pumps. It's another mechanism to deliver insulin for adults and for children as well. We have all these extra technology tools that I mentioned to you. For people that have diabetes and they're interested in knowing what's happening with their blood sugar day to day, there's something called a continuous glucose monitor sensor. And we have professional ones, which are available for someone to use and wear for a few days, just to get a picture of how their blood sugars are trending every minute. It takes a glucose reading every 5 minutes. And the person wears it for 3 to 7 days. And then we get an idea of how their blood sugars are trending over that period of time. But there are some people who own their own CGM, continuous glucose monitor. That's the personal one. And they wear that and they see how their glucose levels are trending day to day. So this is just one example of some of the technology that we have available. And this technology is getting better and better all the time. This is an example of a printout from one of the professional continuous glucose monitor studies. So this person had diabetes, and each colored line here is a different day of the week. And it's very overwhelming to look at, but essentially here you could see, if you see that tall blue line there, that you could see the person's blood sugar taken before dinner at 6 p.m. was, relatively okay. And then they had this huge spike after dinner. Any idea what kind of food that might have been?
Dessert.
Okay, dessert, carbohydrate, all good ideas. Pasta. Well, in this one particular case, this person had Chinese food. So Chinese food for people with diabetes tends to be very, very difficult to manage. There's one other day there. You could see the red line, 6 a.m. to 9 a.m. in the morning. So what do you think that breakfast was? I'm going to give you the hint. A lot of carbohydrate. Well, this was the food in this case.
Cold cereal.
Well, it could be cold cereal. That's a great guess. Yeah, but it was a bagel. So bagels are the equivalent of good New York bagels, 5 to 6 slices of bread, but it's a huge carbohydrate load. And some people find that the bagel, the glutinous aspect of the bagel really pushes their sugar up more than other foods. So, this is how we use some of the technology in conjunction with a food record to help understand what's going on with people's blood sugars. Sometimes it's not the food at all, and that's what the graph shows us. Especially if someone's having troubles with lows during the day, the graph can help us see when those are happening and make medication adjustments. So why bother if you have diabetes or prediabetes to pay attention? I'm going to say especially with diabetes, why bother? Because we know that every 1% reduction in your A1C when you have diabetes will lower your risk of complications, all those horror stories that you heard, by 25%. So if you're sitting there have diabetes and you have an A1C of 8 or 9%, and you get it down 1%, that's a tremendous impact that you just had on your overall health. So that's why I say why bother. Diabetes can affect all the different organs of the body. retinopathy, which is the eyes, neuropathy, which is all the blood vessels, nephropathy, which is the kidneys, and heart disease. So preventing complications, you take a huge role in that, and it starts first with seeing your physician regularly and you working as hard as your physician is to control your A1C, the blood sugar, get that A1C below 7%, your blood pressure, and the fats in your blood. I'm going to encourage you very strongly, make sure you have if you have diabetes, have a dilated eye exam once a year. And I have to stress the word dilated. A lot of people are a little bit confused. They say, oh, I can only go to the eye doctor twice a year. No, that's the ophthalmologist. We're talking about, I'm sorry, that's an optometrist for your glasses. We're talking about a medical doctor. Once a year, go for a dilated eye exam so that doctor can look behind your eyes to see if there are any changes. If you have diabetes, you need to check your feet daily. It's the single most important thing that you can do on your own. And the reason for that is if you have decreased circulation to your legs for any reason, you could have a cut, a bruise, a scrape, and not even know it. And that area, left unchecked, could turn into an open wound. And with poor circulation, that wound won't heal as well. So I have actually a handout here with all the standards of care for people with diabetes, and it emphasizes all the points that I'm talking about. But to the topic of foot care, I have another handout here that, about daily foot care basics. So if you have diabetes, you're welcome to come up and take these handouts. One other very important thing that you can do is make sure you wear shoes that fit. I encourage you to maybe go to a store where they actually will size your foot. New Balance makes a very good sneaker, and they actually have stores all around, and they'll actually, measure your foot. But wearing a shoe that's rubbing the back of your foot, that might not be fitting you properly, that's cramping your toes, can be very dangerous in terms of your circulation. And then the forgotten complication of diabetes is periodontal disease. So you need to make sure you see your dentist regularly, ideally every 6 months. And the reason for that is some people, especially when their sugar's not been well controlled, can develop some gum infections. And that left unchecked could turn into tooth loss. So, see that doctor every 6 months, get evaluated, get a cleaning. So like we said, most of diabetes day-to-day management is up to you. It's centered on choosing what you eat, being more physically active, taking the medications as prescribed. And that sounds funny, but a lot of people go to the doctor and the doctor starts throwing a bunch of pills at them and they don't really understand what all the medicines are. And we hear it over and over. People don't want to take medicines, so they want to try to go their own and they don't take the medicines. At the Diabetes Education Center, we can help you. We can help you to understand what the medicines are that the physicians prescribe, what they've prescribed them, how they work in your body. We can help you track your glucose. We could set you up with a blood glucose meter. We have a dietitian who can give you an individualized meal plan. And then, we can also teach you about all the other aspects of taking care of yourself if you have diabetes. So that's the other brochure that you have in your packet about our diabetes self-management education program. So that's a group class, and we offer them in the day and in the evening. That's you come once for the day or the evening class. It's several days. And then you return in 3 months. And we do an A1C at the beginning of the program, and we do an A1C at 3 months when you come back. And in between, you learn about the things you need to do to take care of yourself. You set your own goals with the educators about what you're going to work towards. And we see, how it's going for you in terms of your A1C. The Diabetes Self-Management Education Program, if you have diabetes, is covered by most medical insurances. And then again, we have the Pre-Diabetes Education Program that's free. So If you don't want a group type of program, like I said, we also have the individual consultation with the dietitian or the nurse. If you wear an insulin pump, we have a certified insulin pump trainer. She's also an individual who could help you do a continuous glucose monitor sensor study if that's something that you're interested in. And this is our phone number. So I thank you for your attention, and I'm here to answer any kind of questions that you have. And I encourage you to take the risk test if you don't have diabetes, and if you do have diabetes, to invest yourself in some time to take care of yourself. It will pay off in the long run. Thank you.